Welcome everyone, and thank you for joining us for today's webinar on provider registration. My name is Gary Rake and I'm the Acting Aged Care Quality and Safety Commissioner, and I'll be the chair for today's webinar. For those of you who would like captions today, there is a small button with two C's, a CC button on the bottom of your screen, and that button will turn on captions for you. I'd like to begin today by acknowledging the traditional custodians of the land on which each of us are gathered today, and to pay my respects to elders past and present. And I extend that acknowledgement and that respect to all Aboriginal and Torres Strait Islander people who are joining us today. I'm joining from renewal country in the ACT, and of course I particularly offer my respect to the custodians of this special place. Today I'll be joined on the panel by Scott Rumbold, our Assistant Commissioner for Audit, Martin Dempsey, Director of our Provider Registration Team, Mimi Roach, another director of our provider registration team, and later Sarah Kelly will join us in her capacity as Registrar, and she'll join us for the question and answer section. Before I begin the discussion, I'll just do a little bit of housekeeping. After we hear from our speakers today, we'll move into a question and answer session. You can ask questions at any time. Just use the question box via the live Q&A tab. That should be visible on your screen now. And we'll also have a short survey for you to complete at the end of the webinar. So please stay online and a short survey will pop up. It'll give us feedback on today's event. It's only short and your feedback is really important to us. It helps us in determining future topics, also understanding the value of the topics and the information that we shared today. Today's webinar will be recorded and we'll be publishing it on our website in the next couple of days. Everyone who registered today will receive a link to that recording as soon as it's available. We'll also share the slideshow from today's session. You'll see that there are some slides with a fair bit of content. We'll share all of that so that you've got the information that we refer to, including the QR codes that we share towards the end. So today we're going to talk about provider registration and specifically varying and renewing your registration. In today's webinar, we'll talk about the different types of variations, what evidence we might ask for, and how much it will cost you. We'll also focus on how the Commission will renew your registration from the initial invitation email through to the assessment and the costs that are involved. I'm really pleased with the strong turnout today. Thank you for making time to join us. I encourage you to share your thoughts, comments and questions through that live Q&A tab. We've had a few questions come in already. So we'll try and get to those when we get into the Q&A session, and we'll get through as many of your other questions as we can today. So let's get started. I'm pleased to kick us off now by inviting Martin Dempsey to start the conversation.
Thanks, Gary, and hello, everyone. My name's Martin Dempsey, and I'm one of the directors in the Registrar. Under the Aged Care Act, providers can request changes to their provider registration at any time throughout the registration period. The Commission has resources and guidance material available to assist providers in submitting requests for these variations. This slide outlines the variations providers may request as part of their registration. Some requests incur a fee, some do not. I will share a slide shortly regarding this, as well as there is a fee calculator available on the Commission's website. Since 1 November, the Commission has received, through the online system, and processed a number of requests from registered providers to vary their registration. We have approved increases to beds at aged care residential care homes, approved new homes and added them to providers' registration, removed homes, and undertaken transfers related to providers' residential care homes. This slide outlines the process for provider-initiated variations. It follows similar processes to brand new registrations and renewals mentioned later in this presentation, with assessments and audits occurring as required. You can see in the first box that providers need to make requests to vary their registration in an approved form. This is called the application for variation form. As a variation only occurs to existing registered providers, an assessment is not undertaken against the provider's general registration requirement, rather against the specific aspects that they are wanting to vary. The second box represents where the forms filled out and providers through the Commission's website need to include all the information outlined on the variation guide material on the Commission's website. I'm going to go through these on the next slide, with some evidence that might be needed to support these different variations. The next box, box 3, we will send you an application invoice with payment required to be made within 14 days. Once the application is received, you'll receive a message with a case ID. In the case of a variation to add categories 4, 5, and/or 6, you will need a variation of registration audit and will also receive an audit invoice. You will need to pay this invoice within 14 days. The fourth box, labelled Registrar, this stage covers the Commission's undertaking the appropriate assessment of an application. If there is a fee associated with the variation request, such as a new registration category or adding a new residential aged care home, the Commission may only start reviewing the application once the invoice has been paid. We may request further information or documents to make a decision about a change to registration if required. Before some changes can be made to a registration, such as removing a registration category, providers must have appropriate arrangements to ensure continuity of care for any of the older people receiving these services. We will provide procedural fairness to all providers if we are considering not to vary their registration in line with their application. And if we do refuse to vary, this is a reviewable decision. A provider can apply for this to be reconsidered. It is important to note that continuity of care is always considered at the heart of any variation to a provider's registration. Before some changes can be made to their registration, the provider must outline arrangements to ensure the continuity of care for older people currently receiving these funded aged care services are in place. The final box, box 5, outline variations of registration audit reporting, just reinforces that where a provider is seeking a variation to add registration categories 4, 5, or 6, there will also need to be an audit undertaken. Following all of this, then a decision will occur by the Commission. The provider will receive a notice of a decision and a statement of reasons. These outline the decision and what was considered in making that decision. Any decisions will then flow onto the GPMS and also onto the provider registrar. This slide, I want to run through the evidence needed to make the decisions and also the timing of these decisions. Timing can be affected by a variety of things. When drafting your application, please ensure that to read the guidance material available on the Commission's website. The guidance documentation provides general information about what is needed for different variations. However, each request is unique and will require specific information regarding each case. To make a variation, there needs to be accompanying materials submitted with this variation form. This is to provide evidence and to satisfy the Commission that if we approve it, that there is no harm to clients. One of the points that we want to stress is that where this requires a certificate of occupancy, which it would be for bed increases in new homes, that providers can submit a variation form up to 3 months beforehand so that the final certificate of occupancy, before the final certificate of occupancy is actually received. This will reduce any delay where a home can be built and potentially being empty while seeking approval from the Commission. We are, however, unable to make that final decision until we receive that certificate of occupancy from you. Decisions can take up to 90 days and can be impacted upon the amount of evidence provided at the point of submission to support the request. I'm going to go through some of the evidence now that might be needed to support a new home. Documentation about how residents of new homes will be admitted. How is this done safely? Description of any strategy such as staged approach for residents entering care. How residents will be assessed to develop tailored care and their clinical plans. Staffing provisions. Planned rosters and statements on how care minutes and 24-hour nursing requirements will be met. If there's a staged opening of the facilities and wing, how the staffing and clients will be affected, induction programs and orientation and onboarding instructions. We're also going to be asking information about how the building is designed for the provision of aged care services. This would also be supported with a certificate of occupancy, but also evidence that identifies the new site and buildings was designed to promote quality aged care accommodation. Any other relevant information demonstrating how the service would be delivered safely at the home, including floor plans and clearly outlining evacuation and fire exits, room sizes, bathrooms, locations of kitchens, etc. Lastly, evidence of ownership of the building is also required. In regards to transfers of homes, similar information is being looked at here from providers regarding the safety of clients and continuity of care. Providing a transition plan and documentation evidencing how the planned transition is to occur, staffing and communication to clients, etc., allows the Commission to review and make decisions on the approval. Transfers should be considered and not rushed, with decisions taking up to 2 to 3 months from lodgement. In regards to varying requests to vary the total number of beds of an approved residential care home, these requests are usually actioned within a month of receipt if evidence is provided, including and not limited to if a certificate of occupancy is needed to reflect the new number of beds, updated emergency plans, staffing, evidence of appropriate building and room design, and also if there is a stage entering of residents as well. If there is at any time of a variation request insufficient evidence or something has not been provided, the Commission will engage with you and seek this information from you. It can be done either through a request for further information or potentially just through a quick phone call. Lastly, regarding bringing beds online and taking offline in residential care, which are not actually variations, from the 23rd of March, providers can log on to the Government Provider Management System, the Registered Provider Portal, to actually then make these changes themselves and record beds as offline or make beds available to use. Here is the table showing the fees and waivers that apply for variation applications as associated audits. These apply when a provider seeks to change their registration to add or remove categories or have a new residential care home approved. A separate charge also applies if a variation audit is required. The fees for variation vary based on the complexity of the variation. Scenarios where a provider chooses to remove a category with individuals accessing care will incur greater cost than removing a category with 0 individuals accessing care. Removing a category does incur a fee. The Commission will need to access and ensure sufficient measures are in place to ensure continuity of care for any current people accessing these services. The key point is that variations are treated as significant regulatory activities, and fees reflect both the type of charge and change and the need for additional assistance through the audit. You can also see the fee waiver criteria for variation applications, which are the same as for the registration. I'm just going to go through a scenario. This scenario looks at what happens when a provider expands their registration through a variation application. The provider is already registered in categories 1 to 5 and is now seeking to add category 6 to their registration. As part of this, they also have a new residential care home to be approved in an MM3 area. Because they don't meet the MM location threshold in the fee waiver criteria and they're not an Aboriginal community controlled organisation, they are not eligible for a full waiver. Altogether, therefore, the fees for this application come to $27,400. This total reflects the fee to add category 6, the approval of the new residential care home, and the variation audit that required when adding higher risk categories. This is my final slide. We have received a variety of questions from providers that are contracted for only CHSP services who want to expand their service offerings. If CHSP providers want to apply to become support at home providers to then expand upon what services they can provide and then claim subsidies, they are required to be registered into Category 4, personal care and support in the home, with the service type care management. This is because support at home relies on the single provider model, where providers must have care management under Category 4 as part of their registration to deliver services to support at home clients. This means two things for CHSP contracted providers. One, some providers of CHSP have already been deemed into Category 4 into their registration. For instance, if they are contracted to deliver allied health and therapy services. However, they would not have care management as part of their service offering under Category 4. In these cases, they will need to submit a change of circumstance to add care management to their registration. There is no cost to this and can be done via a change of circumstance form on our website. The second example is where a CHSP provider is registered in other categories, not Category 4, for instance, transport or home maintenance and repairs. In this case, the provider does not have Category 4 in their registration and will require to vary their registration to add Category 4 into their registration. Provide information relating how they will be able to deliver these services as outlined in our guidance material, and also undergo an audit. There is a fee associated with adding a category as well as the audit. Please refer to information on the Department of Health and Disability and Aged Care's website regarding support at home and becoming a support at home provider, including the provider's obligations. Thank you, and over to you, Mimi.
Thank you, Marty, and good afternoon, everyone. My name is Mimi Roach, and I am one of the directors in provider registration. Providers need to apply to the Commission to renew their registration if they want to continue delivering aged care services. When we receive a renewal application, we assess the provider against the registration requirements to decide whether their registration should be renewed. So I will now walk you through the registration renewal process, what providers can expect and need to do, plus some fee information. This slide outlines the registration renewal process. Starting from the left side of the table, step 1 is the invitation to renew. We start the renewal process before the provider's registration expires. The Commission will send an invitation to renew up to 18 months before the end of the registration period. The exact timing of the invitation depends on the size of the provider and the registration categories they deliver services in. This is because some providers will also need to undertake an audit against the strengthened quality standards as part of the renewal process. Based on the provider's current registration categories, we will also determine and let you know in the renewal invitation letter if you may be eligible for a fee waiver. The next step, which is the third point on the slide, if you accept the invitation to renew and you deliver care and services in registration categories 4, 5, and or 6, you will need to undertake a renewal audit. As part of the renewal process, you can also update the registration categories you intend to deliver services in. For example, you may choose to remove a category that you no longer intend to deliver, or apply to add a new additional category. You may also apply to add a Category 6 residential care home as part of the renewal process. If a renewal audit is required, we will send you an audit invoice at this stage of the process. You will have 14 days to pay the invoice, although extension options are available. The audit process will begin once the audit invoice has been paid. We will then send you a link to the renewal application form by email. The email will include the date that your application must be submitted. Where there is a gap between the invitation to renew and the time the application form needs to be submitted, we will send you a reminder. You will then submit the renewal application form and pay the application invoice that is issued. The same 14-day payment period applies. If a provider does not submit their renewal application, their registration will cease at the end date. However, there will still be ongoing conditions and obligations while the provider works towards ceasing care and services delivery. The final step in this process on the right-hand side of the slide is the Commission assessing the application and making a decision on the registration renewal. Our focus during this stage is on assessing the provider's suitability, capacity, and capability. So in a very simple term, the renewal process begins with an invitation, may involve an audit depending on the registration categories, and then moves to renewal application, assessment, and decision. When we assess a renewal application, the Commission considers the information provided in the renewal application form pack, along with other relevant information against the registration requirements. One of the most important ways we help older people safe is by ensuring that only suitable organizations can become and continue to be registered providers. For that reason, the Commission follows a thorough process when making renewal decisions. Organizations applying for renewal must show that they meet the general registration requirements. They must also meet the registration requirements specific to each category they are seeking to have renewed. As part of the assessment process, we may ask for further information or documents if we need them to make a decision about renewal. We will also consider the outcomes of any audits and other information or intelligence the Commission has gathered. This may include things such as routine reporting, notifications, information from complaints, and outcomes of any risk-based monitoring or compliance actions. When we decide to renew a provider's registration, we will set the categories the provider remains registered in and the new registration period. If the Commission is considering not renewing a provider's registration, the provider will be given the opportunity to understand our concerns and provide additional information. This table shows us the fees providers will be charged when applying to renew their registration. The fee structure is similar to the fees that apply to initial registration. So there is an entity level assessment fee and then additional charges depending on which categories are being renewed. There is also a fee for any new residential care homes that a provider is seeking to have approved. The fees vary depending on categories being renewed. This reflects the different levels of risk and complexity associated with each category and aligns with the work involved in assessing a provider's ongoing suitability at renewal. A fee waiver may be available in certain circumstances. For example, a waiver applies if a provider delivers all their services in modified Monash model areas 5, 6, 7, or if the provider falls within the smallest 10% of the sector. This slide has a lot of information, so it outlines the fees that applies to renewal audits. It shows the cost for provider-level evidence gathering and for category-based audits. The fees vary depending on the type and complexity of the audit. For Category 6 residential care homes, audit fees are tiered according to the size of the residential care home. For Category 4 and 5, audit fees vary depending on the complexity of the audit, which may be low, moderate, or complex. Factors such as number of older people receiving care under Category 4 and 5, as well as whether the services are delivered across more than one state, can influence how complexity is determined. The same waiver arrangements that apply to renewal application fees also apply to renewal audit fees. However, there is an important exception for Category 6 audits. For Category 6 audits, there is grandfathering arrangements. This means that if the criteria previously used for reaccreditation audits will continue to apply. So if a residential care home received a fee waiver for its last reaccreditation site audit, it will receive the same waiver, either full or 50%, for the Category 6 renewal audit for that same residential care home. The waiver criteria will also extend to residential care homes that have not previously had a reaccreditation audit. In those cases, occupied bed days will be used as a substitute for the number of places. On this slide, so we have a scenario to demonstrate how renewal fees and waivers apply this concept in practice. In this example, the provider is registered in categories 1, 2, 3, 4, 5. They provide care and services to 112 older people across modified Monash model areas 1, 2, 3. Their category 4 and 5 services are delivered to 72 older people in a single state. This means the total fees they will need to pay are $34,125. This covers the entity level assessment, the review of category-specific requirements for category 1, 2, 3, 4, 5, and also a renewal audit with the provider level evidence gathering and the moderate complexity audit for category 4 and 5. Because this provider don't deliver 100% of their care and services in modified Monash model areas 5, 6, 7, and they are not in the smallest 10% of the sector, they are not eligible for a waiver. I will now hand over to Scott to talk all things audit.
Thanks, Mimi. My name is Scott Rumbold, and I'll be talking you through the Commission's new audit methodology. I would like to start by covering some principles of the audit methodology that we introduced on the 1st of November last year. The first point is regarding our approach to working alongside providers. There will be ongoing communications and you'll have a single point of contact during the whole audit process. If you have any questions or if there's a change in circumstances, you can engage with that person at any point. Audits linked to the registration process will now be announced. This is a significant change from the previous approach taken by the Commission and one that has been warmly welcomed. The audit team will contact providers to discuss the audit process and help you prepare. We will discuss the availability of governing body members and key personnel to decide when it is best to undertake meetings and the audit. We commence the audit process by gathering information at the provider level once. Previously, and especially for residential homes, we asked providers for their governance and provider level information at each residential home. Another change is how the current Aged Care Act allows the Commission the option to undertake a remote or desktop audit where the provider does not deliver care or services in a service environment. Previously, audit outcomes were given to providers once the audit report had been finalised by the assessment team, but as part of the new audit methodology, audit ratings against the quality standards will be given at the closing meeting. Audits will now be forward-facing. We have moved away from a point-in-time assessment to now look at the effectiveness of your systems and processes to continuously improve and sustain conformance. Graded assessments will also be used to distinguish between major and minor non-conformance. Where a Category 6 is conforming, providers have the opportunity to apply for an exceeding rating. The Commission has also developed a First Nations communication, education and engagement strategy. As part of this strategy, we are adjusting our audit methodology to ensure we collect and evaluate evidence in a culturally responsive way. The audit branch will be seeking feedback from providers on the new audit methodology during the audit process. Your feedback will provide us with valuable insights into your experience and support our continuous improvement. We conduct audits when providers want to register, renew or vary their registration. These audit types have 3 stages. Stage 1, audit initiation. Stage 2, audit delivery. And Stage 3, audit reporting. In the following slide, I'll discuss each stage of an audit using renewal of registration as the example and what providers can expect. Registration and variations of registration audits also include components of what I'll be showing you today. Okay, stage 1 of the audit is audit initiation. The purpose of the initiation stage is to begin the engagement process, confirm logistics for the audit, and provide you with the audit evidence collection tool. The provider is required to review and submit requested documentation via the Commission's digital audit tool portal. You will be emailed a link to the portal and instructions on how to submit documents. We will arrange meetings with you and talk you through the audit process and the timeframes that will apply specifically to your organisation. The length of a provider's audit program is dependent on its composition and size. Larger providers with multiple services or outlets will take longer, and this could be up to 18 months. Also in stage 1, you'll get to meet your allocated audit manager who will be able to answer any specific questions you have about the process. Stage two is audit delivery. And the purpose of the audit delivery stage is to collect and assess evidence in relation to how the provider conforms with the quality standards. This stage is broken into two sections, with one focused on the provider and the other which looks at the delivery of care. The first section of stage two is to collect and assess evidence of the provider's governance arrangements, systems and processes. We will review the audit evidence collection tool and the supporting documentation, as well as any other intelligence held by the Commission. From there, we develop a provider audit plan and schedule for assessments of the care delivery locations and any residential care homes. We will also hold meetings with the governing body and senior management during this stage. The second section of stage two is to test whether the provider's governance arrangements, systems and processes have been embedded and consistently applied in the delivery of aged care services. As outlined in this slide, we commence this process by requesting you complete the care delivery evidence collection tool. You will need to complete a care delivery evidence collection tool for each residential home and selected category 4 and 5 care delivery locations. We will review the information supplied and then develop an assessment plan for each location. After the execution of each assessment plan, we will have a closing meeting to provide details of what we found and the preliminary conformance ratings. Stage 3 of the process is audit reporting, and the purpose of this stage is to communicate the assessment outcomes through a preliminary assessment report, a final assessment report, and a final audit report. You will have the opportunity to respond to the assessment findings in all of these reports. By way of an update with the audit program, we've currently commenced about 60 audits across the country, and today actually marked a significant day where we commenced our on-site audits in a residential care home. It's a new process for both the Commission and the sector, so I wanted to let you know that we will have an audit-focused webinar later this year, where we'll be able to provide more detail about the flow of audit processes, audit timeframes, and what we are finding. A key element to conformance ratings is allowing providers the opportunity to review and respond to the findings. This slide details the 3 ratings that can be applied against each outcome of each quality standard. Minor non-conformance is where we find gaps in the implementation of corporate governance systems, but they do not present high risk to older people. Major non-conformance is where the provider has not implemented systems and processes, and this does present a high risk to older people. As I mentioned earlier, the Commission has developed a First Nations communication, education and engagement strategy, and we have created dedicated First Nation pages on our website, and you can access these via the QR code on your screen. The strategy and these pages are part of our ongoing commitment to ensure that First Nation communities, aged care workers and providers have the tools and knowledge they need to deliver high quality care. There are materials available to support providers throughout the audit process, and in particular, how to provide the Commission with sufficient and relevant evidence. There are also a range of resources available, including communication material for older First Nations peoples to support community participation in the audit process. Just a quick reminder that we'll be sharing these slides in the next day or two. So if you've missed anything or the QR codes haven't worked for you immediately, you'll have all the information by close of business Thursday. Provider audit guides are also available on our website, and you can access them via the QR code on your screen. They provide details of everything I've just gone through in relation to the audit process and more. Look, you're probably familiar with this page as well, but it's worth reminding you about the central hub of the latest information and resources from the Commission to support older people, providers and aged care workers. These pages provide a lot of information about the Commission's function and processes, but in particular, and relevant to today's webinar, it will direct you to information about the quality standards, provider governance, provider registration processes and audit. This QR code will take you to the provider registration area on our website, where you'll find information, guidance and resources. I'll now hand back to Gary for the Q&A section of today's session.
That's great. Thanks, Scott. And thank you to all of our speakers. We'll now move into questions and answers. And so I'll have Sarah Kelly, our Registrar, will be joining us again. And we'll have Scott, Martin and Mimi available to answer your questions. And thank you for everyone who are submitting questions already. So I'm going to start with a question for Sarah. Sarah, why are providers being asked to renew registration now when their organisation registration period might not end until the end of June 2027?
Thanks, Gary. I think Mimi touched on this briefly in her presentation. If you are being asked to renew your registration now and it's not actually ending until next year, I would say that's probably because you're going to need an audit as part of that renewal process. So we determine the amount of time that we need to go through the renewal process. So if you are registered in categories 1, 2 and or 3, we'll probably come and approach you about 6 months before the end of your registration period. That allows enough time for you to go through and fill out the application and then for us to actually assess it and make a decision on it. If you're going to need an audit, and again, it would depend on how big that audit might be. So you might have 1 residential care home, you might have 50 residential care homes. So depending on the size of your service offering in categories 4, 5 and or 6, will come to you a period of time to allow for that audit process. So that might be sort of between 12 to 18 months before the end of your registration. Thanks, Gary.
Terrific. Thank you for that. Next question I think I'll throw to Martin. Martin, how should providers notify the Commission about changes such as expanding bed capacity, key personnel changes or reaccreditation? And can providers submit one single application or notification, and should they expect one single audit?
There's a couple of things in that question. Firstly, we have to receive it through a formal form to vary the actual aspect that they want to vary. There's a couple of things. If it's a responsible person, it could be a change in circumstance form, not a variation form. We would be receiving any of the variations to add different service types or a new aged care centre or to transfer through a variation form, and we would be engaging with that provider in regards to any of the information that they need to provide that they might not have. And there would be, depending on what they're asking for, different fees associated with it.
Thanks, Marty. Next one I think I'll throw to Scott. Scott, if one residential service is found to be non-conformant, will this impact on the other residential services operating under the same provider? In other words, could all sites potentially fall short on renewal if they're listed under that same registered provider?
Yeah, thanks, Gary. Essentially, it depends on what the gap is, but essentially, yes. As I said, as we're going through that process, if we provide that there is a provider system and process gap, it may well lead to non-conformance at different locations until that issue is rectified. How we do business within the Commission, we may monitor that provider for some time to track how they're going against that, the gaps that we've identified, and to track their remediation process. But it's also possible that that gap might be isolated to that one, let's say, residential care home, and that we don't experience that gap elsewhere. So tricky question to answer, but it's sort of 50 cents each way.
Okay, thanks. I'll throw this one to Mimi. Mimi, what's the registration process going to be for those in categories 1 to 3? How will they be required to demonstrate that they're meeting their responsibilities and obligations if they're not subject to an audit?
Thanks, Gary. So when we renew providers registered in category 1 to 3, it actually follows a very similar process for renewal requirements for those ones with audit, but without audit. Let me step it through. So we'll invite you to renew your registration before your registration period ends, likely perhaps somewhere about 6 months before your registration ends. And you will be sent the application link to renew, and then you can provide your organization information and also response to those categories you want to remain registered in your application pack. You will need to demonstrate in your application responses and supporting evidence that you can meet the relevant requirements and obligations. In other words, as a provider, you are expected to demonstrate to us how you are continuing to meet your obligations and responsibilities as a provider through your renewal application pack and all the additional or supporting evidence you are submitting to us, rather than providing that through an audit. By saying that, if we need a little bit more information from you, we can always contact you either through the phone call or a formal request for further information to get whatever the gap is. Thanks, Gary.
Great, thank you, Mimi. Scott, I've got another one for you. Can you clarify how the care delivery locations will be selected for home care providers, specifically those who only deliver care within people's homes?
Yeah, thanks, Gary. Where an aged care provider only delivers care within older person's homes, the care delivery component of the audit will most likely be completed remotely. That's something that I touched on in my presentation. We use information given to us by the provider and intelligence we hold to inform care delivery locations and outlets chosen for sampling. When selecting a sample, we focus on care delivery locations that are concerning to us, such as potential risks to older people. Where it's possible, we aim to include at least one service in a metropolitan, regional, rural or remote area. Coverage of all service types subject to the standards. Older people with different cultural backgrounds and diverse groups, such as First Nations peoples and those living with dementia or cognitive impairment. And also people living in low socio-economic circumstances. We are proportionate in deciding on the size of the care delivery target sample, and we choose to target sample size that allows us to conduct a thorough audit and exclude additional services that will not add anything to the thoroughness. A carefully selected sample of 3 to 4 care delivery locations may be sufficient to ensure coverage of all quality standards, regardless of the number of care delivery locations operated by the provider.
Right, thanks for that, Scott. And thank you, people. Please keep sending your questions in. We've got about probably another 15 minutes that we can keep going with questions. I'll have a few more for you in a moment, Scott. I'm going to answer one myself just so that I feel useful. Will there still be unannounced on-site compliance monitoring visits for residential aged care, so separate to audits? And the answer is yes. We still will be doing our risk-based monitoring inspections. Some of those will be announced, some of those will be unannounced. Could I ask you, Scott, could you explain a little bit more what forward-facing audits are?
Sorry, Gary, just found my mute button. In terms of forward-facing audits, again, it's sort of coming back to that presentation where we're looking at, as I said, not looking at point in time, where previously we would assess what was happening at that point and then make a determination whether there was what was compliance with the quality standards. In terms of forward-facing, we look at and assess the information that we've received, but then we look at the provider's, response to any gaps or any issues that we found, and then review their material to continuously improve and continually make changes and adapt to challenges they face. We understand there's a whole range of challenges in the aged care sector, but we're looking for businesses to be responsive and to adapt and be able to make those changes moving forward. So as I said, if we do find gaps, we're really interested to see what the provider's response is to that and what the future looks like for that organisation. As I said, we're really looking to work alongside providers and understand what the future holds. And that sort of even comes back to my point around wanting feedback from providers about how we're doing business too. So we're looking forward as well, and we're looking to continuously improve.
Right. I've got 2 more audit questions for you, Scott, and then I'll distribute some registration questions to Sarah, Martin and Mimi. So the first one, and I think both of these were covered in your presentation, but let's just answer them again. Will providers be notified in advance of an upcoming audit, similar to NDIS processes? This is for a home care provider rather than a residential service, and so they're worried that auditors arriving without notice or with very little notice would be operationally challenging. So they're just wanting to check, will providers be notified in advance of an upcoming audit?
Yes, 100%. So yeah, everything's announced moving forward, and that's regardless of whether it's category 4, 5 and 6. We'll definitely be announcing audits. Speaking with a range of providers, they were, talking to us around the availability of key staff to be, available to participate in audits, and that's what we talk to each provider about, just to make sure that they've also got the right people available for that process. We've heard from providers that it can be quite stressful when the commission does rock up unannounced, and it was quite a stressful experience. So that's, again, that shift in approach, and we'll definitely announce and talk to the provider about what to expect and when to expect it.
Right. And last little question for you for the moment, Scott. Will the CDECT be required to be submitted for a site prior to the visit or on attendance?
that will be required prior to us going on site, and we review all that documentation, and then we develop a site audit plan, and that's when the 2 staff that will come on site, then they execute that plan, and they have clear guidance as to who they need to talk to, what questions they need to ask, and also any material that they need to collect when they're at that care delivery location or that residential home.
Great, thank you. Next one I'm going to throw to Sarah, just asking, will the registration renewal pack be available publicly so that organisations can consider it before they're invited to renew?
I presume by that, so all the guidance is available. If for some reason the form itself isn't available, and I think that possibly is the case because we send people a link to it, I don't see any reason why we can't make it available. We just need to make sure that people are filling out the version of it that we need, because through that form it gets sort of ingested into our internal system. So I think we're probably a little careful about version control, but I think we can probably do it in a way so that people can actually have a look at the kind of questions and areas that they need to provide information. But there is definitely detailed guidance which also does track through sort of question by question as well.
Fantastic. Now, Sarah, I'm happy for you to have a crack at this one, or it might be one that Martin or Mimi can help with, or we might need to take it on notice. Approximately how many residents would equate to a provider being in the smallest 10%?
Oh, well, it's a very good question, because it just depends on the size of the sector. So it's a dynamic measure and it changes over time. So I don't know what it is at this very point in time, but we can certainly find that information and make it available. What I can definitely tell you is that if people meet waiver conditions at point of renewal, we tell that to them when we invite them to renew. So people will never ever have to gather that information and sort of make a case to us, for want of a better word. We use data that is available to the Commission, and we will tell people when we invite them to renew that they are eligible for a waiver at that point in time.
Great, thank you. Now I've got a question about an accreditation period that expired or expires in May 2026. The provider is saying that on the My Aged Care website it says the registration period expires December 2026. So accreditation was May 2026. Registration is December 2026. They've not yet received an invitation to apply for renewal at this stage. Is this likely to mean that their accreditation period has been extended and they won't have an audit against the standards until later in the year?
I suspect, just from the language of the question, without knowing the detail of the situation, the term accreditation is a term that applied under the old Act. So I'm presuming from this that the provider has a residential care home that would have previously had an accreditation period that sounds like it ends in May. So at the point in time that they were deemed under the Act, they would have been given a renewal date in relation to registration. That sounds like it's further towards the end of the year. And what that means is everything is now tied to that date. So whether you've got 1, 2, 3, 4, 5, however many residential care homes, or you've got service delivery in categories 4 and 5, that will all be looked at through an audit that is tied to your, as the registered provider, to your renewal. So I would say it sounds as though it's later in the year, because we would have got in touch with you to invite you to indicate if that you were wanting to renew. If you had a date in May, we would have well and truly done that by now.
Right, thanks, Sarah. I have one more for you, and then I might throw a couple to Martin. As a registered provider, is there an ability to bulk upload our associated provider details?
Now, this is a question that quite a few people are asking, and we completely get where people are coming from. And what I can assure you is that we are building as fast as we can build at the moment to provide 1, possibly 2 options for people to be able to bulk upload associated provider details. We will let people know as soon as that's available. It's definitely not now. It's not going to be tomorrow. These things take a little while. There's quite a lot of complexity to them, and we've got things like cybersecurity issues that we need to make sure we are absolutely bang on. But we have absolutely heard people's concerns, and we are definitely building, and we will come out and let people know when it's available.
Terrific, thank you. Martin, I have two questions that relate to new beds and new homes. So the first one, our organisation is building new beds at an existing residential aged care home. Do we need to make any application to activate new beds?
Yes. So they would have an approval for a certain number. Let's just use 100 as a round figure. They've got an approval to deliver 100 beds at that particular site. If they're increasing it to, let's say, another 15, and that can be done for multiple reasons. It could also be where they're having beds, rooms be converted into couples rooms, so it could be increasing there. What they'll need to do is apply to vary the registration of that particular residential aged care home, ARCH, and provide us with some information. Some of the information we'll be looking for is if they've increased the bed numbers, that might also trigger a new certificate of occupancy, because depending if it's a new wing, for instance, or something like that, where the old certificate of occupancy might have only covered a certain amount. We would probably be asking for the certificate of occupancy regardless, just to make sure we've got it on our records. We'd also be looking at if there's a significant number, like 15, well, they're going to have to probably have more staffing to be able to look after those particular clients in there. Are they all coming on one day, or is it going to staged approach? And also things like training of the new staff that are going to be in there, how they're going to be meeting their care minutes, etc. New evacuation plans, up to date, those type of documents as well to support the request. Bed increases are usually the easiest ones for us to actually do, because we do support. We know that providers are already delivering services at those particular sites at the moment, but we do need to have some evidence in terms of the increase of the services being provided there and how they're going to be able to safely meet that.
Great, thank you. Now, this next one takes it a step further. A current registered provider in the process of building a new residential aged care home. We understand this will proceed as a variation to our current registration. We have a current planning permit and a shovel-ready project. At what point should we apply to vary our registration? Should we do it now or wait until we commence construction?
I'll be definitely waiting to commence construction. We have to wait before we can approve. One of the things in the legislation is that we must have a certificate of occupancy. I sort of tried to go earlier in my presentation to say, start building, start doing all those type of things. You can submit information to us to vary your registration to add this new facility with everything except the certificate of occupancy, maybe 2 or 3 months before you're expecting it to be provided. We would then review all that information and just wait and keep in contact with you, and you guys keep in contact with us. And then what we'd do is we'd wait for that certificate of occupancy as being the final sort of ensuring that the building that's is being built is meeting all of the certification that it must. So I'm assuming that it's probably pretty long out from that question. So I would be waiting until about 2 or 3 months. One of the problems that we don't want to have is a provider coming to us with everything and expecting us to be able to make that decision the next day. So we do appreciate if providers could submit all that information minus the certificate of occupancy a couple of months beforehand.
Right, thank you. Scott, I'm going to call you back in for a couple more audit questions. If a provider is operating multiple homes, are they able to stagger the audits for the services so that they're not all being audited at exactly the same time?
Yeah, thanks, Gary. Most definitely. So once we've done the provider level review of the organisation and looking at their systems and governance processes, then we start to look at their care delivery locations or their residential care homes, and that's where we develop an audit schedule. For some of our larger providers, when we're talking even sort of 10 to 20 residential services, we only plan 3 to 6 months in advance, and we do a bit of a prioritisation there where we look at risk and we look at some of those indicators as to which services or homes we'll target first. But again, we talk to the provider about that. We talk about what we're thinking and adjust to what their needs are as well in terms of things like leave and the availability of staff. But it's all very much announced, and we don't do things concurrently. So we'll finish one and then move on to the next one. So it won't be happening at the same time.
I've also got a question here, Scott, about the level of detail that we're seeking in completion of the Audit Evidence Collection Tool, the AECT. Could you give a bit of a sense of the level of detail and whether that tool is available for people to review in advance.
Yeah, thanks, Gary. So the audit evidence collection tool is definitely available on the Commission's website. Some of those QR codes, and if the presentation comes out, you'll be able to get a direct link to accessing that tool. Also, the care delivery tool is also available on our website. As I said, we've kicked off about 60 provider level audits. So we've received about 60 different audit evidence collection tools, and we're seeing a great variance in response to that. Some providers have provided close to 500 documents in responding to their governance systems, where usually we're seeing around about 150 documents coming in from providers. That variance in what we're seeing received shows us that there's a little bit of not confusion, but providers are thinking a little bit of, there just needs to be further clarity around what providers need to provide to us in response to that tool. So we're going through a process now of reviewing what providers think they need to submit and what we actually need. And then we'll be looking to provide some communications out to staff, to providers of staff very soon around what we're seeing, and just to provide some additional guidance. That will also, in terms of the audit webinar that we're going to be hosting in a few months' time, that's where we're looking to provide some very clear information to providers and sectors with regards to the audit evidence collection tool and what's required at that provider level, because there is a little bit of confusion out there. So that's on us and my team just to provide a little bit more clarity for the sector.
Right, I think we've got time for just one more question, and I'm still with you, Scott. Could you give us an indication of the average timeline between submission of the audit evidence collection tool and when the meetings with the board and managers would first occur?
Yeah, nice. Thanks, Gary. This is quite common, actually. We're seeing this come through a fair bit, and I met with Ageing Australia on Friday, and this was a question that they asked as well. So generally, once the audit evidence collection tool is submitted, the timeframes for the governing body meeting to commence is approximately 10 days. So sort of 2 weeks for us to arrange that. After that, it's a few days between the meeting with the governing body and then the senior management meetings. These meetings are virtual, and we've had some questions around that. So providers have said it's quite difficult to get these people together sometimes. So these are virtual meetings. And then the next phase of the audit, when we talk about stage 2, that commences approximately a week later. That's where we request for the care delivery evidence collection tool, that's where we ask for that tool to come in, and that commences, signifies the commencement of the care delivery location or the residential care home assessments. The location visits will commence a couple of days after the opening meeting of each assessment, which is held virtually, as I mentioned before. The timeframes for the care delivery location component can and is varied depending on the circumstances and the size of the provider. But as I said, we have ongoing communications in all those meetings that we have with the providers and their management teams. We talk through your specific circumstances and map it all out. I guess there's full transparency around what we're thinking and what we're planning.
Fantastic. Thank you for that. Now, that brings us pretty close to the end of today's session, and I apologise we didn't get through all of the questions. What we will do is look at where there are themes coming through in the questions and test whether we can put together some further answers and information to share with people through our website or through our other channels to help share that information and answer those questions. Thank you all for joining us today. So as a reminder, the webinar has been recorded and it will be published on our website in the next couple of days. Everyone who registered to attend today will receive a link to that recording. You'll also get the presentation with the QR codes. They'll help you make your way through to our website, and I encourage you to go to our website and look at those resources that we talked about during the session today. And finally, just a little reminder, there will be a survey come up on your screen as soon as we finish this broadcast. Please take a moment to give us feedback on today's session, and that'll help us shape future information sessions. Until then, thank you all for joining us, and we'll see you next time. Bye.